Who do I pass on to now?
It's me.
Oh, well done, Julie.
Seamless. Fantastic.
Thank you.
So thank you, Anton and Push. As I said, really fantastic. We're going to move on now to the final showcase session, which I'm really pleased to say is something that I'm hugely passionate about and we touched on this morning. So this session is about delivering healthcare leaders of the future. And my role really is to introduce Helen Thomas, who, to be honest, has done all the work on this with her wonderful team. Helen's going to take you through a short presentation in line with the format of the previous showcase sessions. She's going to tell you a little bit about our vision, the principles that we've developed, what we've done to date, and then take us on the journey of our route map to where we want to get. And then finally, hoping the technology works, she's going to give you a bit of a teaser and a taster on the Gwetler digital leadership portal. So, and then, as I say, in a similar format, there'll be a time at the end to ask questions. So if anybody's got any questions as we go along, you can just type them in the Q&A bar. I can see a couple of colleagues have joined for this last session, so just do that and we'll pick them up at the end. Okay, so Helen, presentation loaded. Are you there?
I am. Thank you, Julie.
Fantastic. Bendigedig.
Okay, thank you for the opportunity to share some of the work that we've been doing in line with our strategic objective 3, which is working with partners to influence cultural change within NHS Wales through building capacity in compassionate leadership. So you'll see on the screen our workforce vision for health and social care, and that is by 2030 all leaders across our system will display compassionate leadership, which encompasses collective leadership. So there are 3 key underpinning actions around this. The first action is around having a consistent approach to delivering compassionate leadership capacity across health and social care in Wales. The second action is around provision of leadership development for individuals and for organisations across NHS Wales. And then the third underpinning objective around this is about capacity building. So what is our succession planning and talent management process that we need to develop? So compassionate leadership is needed to instigate change, empower others, create the conditions, the safe conditions that Anton was on about and spoke about a little earlier, to ensure that staff are engaged, they can deliver innovation, they can deliver ever-increasing safe quality care to our communities. And to do that, compassionate leadership is an evidence-based approach to the leadership that we need across health and social care. So the evidence is profound. It's being supported by all of the organisations, and this is sort of to distill really what we mean by compassionate leadership. There are 4 components to this area. The first component of compassionate leadership is about being in attendance, so being present with that individual, more than just being in the room, but really listening to what they're saying, listening with fascination, as Nancy Klein would say, to those that we lead or to those that we're engaging with. The second component of compassion and compassionate behaviour, compassionate leadership, is understanding. So only by being in attendance and being present will you be able to develop that real good understanding of what that individual is saying, taking that time to listen, taking that time to understand the challenges, taking that time to try and understand what is not being said. By completely understanding the challenges and the frustrations maybe that individual is sharing, move on to the next component, which is empathizing. So it's having that feeling of what those strains are with that individual, the anxieties, and that's all without being overwhelmed, because then that provides us to give that capacity to help that individual or to help our teams to unblock some of those maybe frustrations, obstacles, and to enable them to deliver, provide the autonomy for those individuals to deliver ever-increasing safe quality care to our communities. So those 4 components, what we've tried to do is pin it together in a compassionate compass. and you can see that there's a North Star there. And we're hoping that sort of like that North indicator becomes our North Star and enables everybody to understand what we mean by compassionate leadership really easily. And I find myself sometimes reflecting back on this compassionate compass, especially when we're in back-to-back meetings, thinking how in attendance was I just at that Teams meeting? Was I really understanding some of the complex issues that my colleagues were trying to deal with? And how did I help explore and unblock some of that? So that is what we meant, I guess, by compassionate leadership. We also have then developed some compassionate leadership principles in partnership with our colleagues across Health and Social Care and Academy Wales, again to help us guide us as a system, I guess, to work collectively across boundaries to promote inclusion, equality and health and well-being of our staff. Because we know if we provide that environment and we support our staff, then we can give better quality care to our communities. So we launched the first iteration of our compassionate leadership principles in March this year, which collided sadly with the COVID pandemic. We had some responses which we took. They were very positive, helped us maybe change the wording, amplify some of the messages, and the second iteration of our consultation document is now out, and you can see them on the screen there. So that closes the 27th of this month. We've had some really encouraging and supporting consultation back. Really things like, why wouldn't we as leaders work collectively towards creating that inspiring vision? Why wouldn't we as leaders develop safe, trusting and engaging cultures? So very supportive feedback, but also very really good snippets, good observations that we can hone to finalise this version and then hopefully launch towards the end of the autumn. So in line with creating a consistent approach to developing leadership, which is the principles and which is that compassionate leadership compass, we've also got a bit of a route map here that looks at how we are unblocking and taking forward, I guess, some of the other strategic actions, which was around creating leadership capacity through development of programs, but also some work around succession planning. So at the bottom of the screen, we've talked about our development, our compassionate leadership principles. The next route map flag highlights the launch of Gwella, our leadership portal for Wales. And on Gwella, it's an open source, easy access environment where all staff and all individuals across Wales can hop on and access a huge range of compassionate leadership resources. And these resources have been harnessed from a lot of our colleagues, from Professor Michael West, from the King's Fund, from our colleagues across the UK, Health and Social Care, and Open University, and other partners. I'll hop onto that later and show you, but that was launched and it's had over 6,000 views already and some really good feedback. During COVID, we also used Gwella to integrate virtual classrooms. And again, this was alluded to a little earlier on. So we integrated virtual classrooms into Gwella so we could then provide digital learning materials as well as virtual classrooms. So when we were perhaps supporting organisations to train, to develop education, to onboard staff, for example, we could do that in a remote and rapid means through virtual and digital opportunities. So we could really get, with simulation coming on board, a really blended approach. And I think that has actually changed the way in which we educate and train staff across NHS Wales. Again, through COVID, we created a range of digital materials that was done in partnership with our Professor Michael West, who was working as a critical friend with us. And again, we created some masterclasses. Those digital resources for leading compassionately through COVID and health and well-being, again, were accessed over 50, 60,000 times by individuals. And individuals not just across NHS Wales, but across the UK, and indeed the World Health Organization are also using some of these materials to promote a compassionate approach to providing health and care. Our next flag is the launch of Talentbury, and I'll come back to that on the next slide. But in line with our succession planning strategy, we will be launching the NHS graduate programme, and that will launch September 21, and the recruitment and marketing of that will commence this October. I'm pleased to say that each organisation across Wales are keen to participate in this programme and support a graduate. So 13 graduates will be commencing on this programme next year. We are also looking and working with the King's Fund and with Professor Michael West and creating a range of executive leadership masterclasses, executive leadership development programmes and multidisciplinary clinical leadership programmes. And all of that will come online towards Q4 and Q1 next year. And in line with our strategy for creating capacity in compassionate leadership across the system, but also at an executive level, we'll be establishing an NHS Wales Talent Board, and Dr. Andrew Goodall will be chairing that with executives from each of the organisations being represented. So as well as developing opportunities through HEIW to grow leadership capacity and skills, we'll be providing ideally opportunities for experiential learning. So we know how difficult it is to step into an executive position. So this talent board can hopefully open opportunities where you can step into these positions safely through maybe a secondment or a trial or undertaking a national project, etc. And then finally, in line with the succession planning, but also, as you've heard earlier on, with Grow Your Own, apprentices, etc. We're looking to pilot an NHS internship, and next year we'll be working with our universities and our university students to create what we think will be a really, really good internship for NHS Wales. So if that's going to be world-class, what will that look like? So they'll be helping us develop and pilot that. We'll evaluate and hopefully scale up. So those are some of the sort of key milestones along our journey for the next the next 6 months, 12 months. I mentioned Talentbury earlier on. So Talentbury is probably the most ambitious virtual event that NHS Wales has hosted to date. So no pressure there for us. And as it's denoted, it's set up like a festival. So Talentbury will run for 4 days. It will run from the 21st of October on a Wednesday, and it will conclude on the following Monday. There are opportunities there to experience really good keynote leadership speakers, to experience opportunities to engage in workshops, to collaborate with us on what you need and what people need going forward, to develop into these executive positions, and also to hear, for example, on our Pathways to Leadership map, some UK leaders talking about how they stepped up into executive positions and how scary that was, what mistakes they made, what they learned from it, and how they dealt with some of those challenges. So hopefully people will actively engage on all of the sessions, but for those that some may miss, we will have an on-demand weekend where we'll be recording the sessions, and then those individuals can access them from that weekend. And then these will be transcribed and translated and available further down the line in our resource library. So finally, I wanted to just talk about Gwella, our leadership portal, and I'd rather do that live. So if you bear with me 1 second, I'm just going to whiz over to a different screen, ideally. And hopefully you are looking at a screen that has a homepage and it says Leadership Principles for Health and Social Care in Wales. So what you're seeing there is Gwella. It's our leadership portal for NHS Wales. And I'll just take you very quickly through it. As you can see on the rotating bar here, this is some of the latest news, and this will change daily and weekly with new items that are posted onto this Gwella site. We've got about Gwella, I'll come back onto that in a moment. We've got our talent and succession area. We've got a graduate programs area, and I mentioned about the graduates earlier on. What we will be doing when we start recruiting is pointing them into this page so they can see the eligibility, some of the details on the programme, how to apply, a video of what they can expect from engaging on this programme, and also some videos of previous graduates and what they had out of the programme and where they are now in the system. So some really exciting opportunities there. resource section. So I'll pop onto that in a moment. But if I just scroll down the screen, you'll see that we've got latest news. Anything that comes up in the next few days will be posted there. And importantly, up and coming events. So you can see there's a masterclass with Professor West, and we've got a lot of things going on. HEIW with regards to leadership. So the intention is that this is wholly accessible and it's a one-stop shop for all leadership development. And as we share this with our colleagues across NHS Wales, we hope that they will start to post their leadership and management events on. So this becomes truly multidisciplinary and indeed multi-agency going forward. Just to mention there, this is a fully bilingual system. I've hopped on to Welsh there and you should see that everything is now translated. So that's a great achievement, and that's been achieved by some brilliant work with our Welsh leads and HEIW in HEIW. So I'm just going to go back on English. Apologies, I don't speak Welsh very well at all. So I'm just going to pop onto the resources section of this page and just show you what we've done there. This is wholly accessible to anyone. And you can see down the left-hand side, the taxonomy has been created around clinical leadership, leadership resources, management resources, etc. If I pop onto our leadership resources, again, our taxonomy breaks it down into tools, publications, etc. And you can just drill down. Now, you would have noticed at the top here, the screen, the login actually gives access to people that are on development programs or in networks, but that login also gives ability for individuals to create their own personal learning clouds. So those resources that you see, you can just whip them into your own personal learning cloud, and then you've got them there to turn back to or to access at your fingertips. And the very last thing I'd like to show you really on Gwella is some of the materials that we've created. So I'm going to hop on to our page. You should see a little bit there about compassionate leadership. There's a really effective video there. It's only 3 minutes or so, and that reflects our last year's conference. And you can hear our leaders in NHS talking about why compassionate leadership is essential to go forward and for transformational change across NHS Wales. And then we've created, if you like, some resources there. 5-minute reads, 3-minute reads, etc. I'm going to hop onto this compassion in health and care, which is in our resource library. And to launch this, just to give you a feel for the digital learning that we've made available across the system. So you can see that I'm just going to click on the sidebar, and if you can imagine you looking at this on a Kindle or on your iPhone or on a tablet or anywhere, you can just flick through these. This resource, as you can see, has been created by Professor Michael West for HEIW to share across the system. And our Gwella portal ideally will be fully accessible. We are just finalising the accessibility testing around that with our partner. So if you can just imagine that Professor West has provided some brilliant materials for us that are all evidence-based and all educationally sound, and it come on a Word document. So what my colleague Emily has done is taken that Word document and made it really interactive. So you can just pop into this, get a feel for it, make it easy to read, easy to understand, and really appealing. So you can see here, it's describing what is over the next few pages. And then you can see it's been set up in quite an accessible, easy, so compassion leads to better health outcomes, and it tells you what that means, but it's also indented with references. So let me give you an example. Compassion leads to better health outcomes. Anton, I'm sure you'll be keen for me to just zip on here, the anaesthetist one. And you can see that there was a randomized controlled trial with researchers for Harvard, and they said that if you give compassionate care, you give less opiates and people recover a lot quicker. It sounds unbelievable, but if you look at the references, you can go straight into the randomized controlled trials and just read more about that. So I just wanted to share that with you because I think these materials are really interactive, really accessible, and are being used right across the UK system and beyond. And just to mention as well that this sort of portal and our approach has been shortlisted in the Learning Technologies Award for Best UK Digital Transformation of Training. And Anton, I believe earlier on you said you've just moved on to a digital forum and you're using virtual classrooms, and I believe it's part of this, this network that you're using. So thank you for your support on that. So I'll stop sharing my screen, I'll be quiet, and I'm happy to answer any questions.
Thank you, Helen. That was fantastic, and I am just immensely proud of the work of the team, which, you know, people have contributed to from across the organisation, but obviously under Helen's leadership. So I can see, I know John wants to come in. So John, is that okay if you come in now?
Yes, thanks, Julie. Excellent presentation. I've seen that before, Helen, haven't I? So it was really good. I'm so pleased that you mentioned health and social care. And I think it's important that we create leaders who can move across traditional organizational boundaries seamlessly. And I'm hoping that there is the potential to do this. And maybe one day people can move between healthcare, social care, and even into the civil service and become leaders who in a sense, break down the barriers between those organizations. Do you think there's the potential for us to do that?
Yeah, I'm happy. I'm happy to come in on that. Absolutely, John. I think that's so exciting. I mean, obviously, some of the elements of this we have developed in partnership with Social Care Wales, and we have, you know, had support as well from Academy Wales. But I think the pace at which we can progress some of these things in the NHS, just because we are one system and there are 11 organisations, is much easier for us to sort of get on with some of this stuff. So everything that Helen's shown, we are sharing. As I say, the compassionate leadership principles are a joint piece of work, and social care colleagues can access the materials. But I think for the next probably 1 to 3 years, they're on a slightly different trajectory to us, with some areas of what they're doing is actually further ahead than we are in the NHS. Some areas we're actually in advance, but ultimately, in line with the workforce strategy, we would be looking to develop leaders who can move across the public sector. So longer term vision. Thank you. And Harold, if we haven't got any questions, I know there's been a couple that have been asked and we've dealt with. I've got Ruth who's saying she'd like to come in, so that would be lovely. Thank you, Ruth.
Thank you very much. And thank you again for that presentation, which is really enjoyable and really encouraging. And well done on the Gwella portal. And it's so nice already to see good feedback on that. I just wanted to ask about opportunity. It seems to me that some of the individuals who might have the potential to make the best compassionate leaders are possibly the least likely to come forward. Or they might be more reluctant to come forward and need encouragement. And I just wondered how we're going to make sure that we are providing access, you know, equitably across the various disciplines and personalities and so on, who could really help to push the compassionate element of this.
Thank you, Ruth.
Yeah.
Do you want me to answer that, Julie?
Yeah, that's great.
Okay, thanks. Yeah, very great observation, Ruth, and yeah, something we're very conscious of as well, because sometimes the tall poppies are the ones that get recognised and promoted or put forward for some of these positions. What we are doing at the moment is looking to integrate talent management software into Gwella. We're working with some educational consultants at the moment and psychologists to develop profiles. So what does success look like? And then that would be inclusive, so anyone could go onto the talent management section, have a look at what that profile looks like, undertake a self-assessment, undertake a 360 assessment with colleagues and peers, and that would generate some output around where the strengths are, where some of the maybe development areas are, and then they can contact us to be supported and then ultimately join the talent. The talent pool. So we're making that really inclusive for it to be manager nominated or individually nominated, and making all of our materials accessible. So hopefully that answers some of your question, but it's a really valid question and something that we're really mindful of, hence our approach.
Thanks, Helen. I think just to add to that as well, obviously, as we've considered the Strategic Education Review tender specification today, and just to remind people that we've built compassionate leadership into that. So, you know, ideally, as people sort of come through the system, through their training and education, this is part of their DNA. So I think that's a really important opportunity, but also we are unashamedly trying to sort of talk to everybody that wants to talk to us, which can cause challenges with the diary now and again. But you know, as many ambassadors as we can create at all levels with people who are really up for this and interested in it, then we're on that sort of mission really to just spread the word. So thank you, Ruth. Okay, and Herod, have we got any questions in the box?
No further questions, Julie.
Okay, well, if that's the case, then I'd just like to say thank you for staying on for this session, and thank you to Helen in particular for all of the work that she's leading and for preparing today. Unfortunately, Alex and the chairman have had to go off to a ministerial meeting, the timing of which has changed, so they're really disappointed to be not able to close the session today, so they've asked me to do so. But before I do that, has anybody got any final comments that they wanted to make before we close down? John, did you want to come in?
Thanks, Julie. Yes, Chris just asked me, because as you say, he's had to go to another meeting, to thank everyone for joining our showcase this afternoon and for giving us an opportunity to share some of what we do, and hopefully for you to perhaps even make new contacts. You never know. And also, could I thank all the participants? I mean, I've seen in the chat box, we've had some absolutely fabulous presentations, been really informative. And I know that Chris would like to say that you've done a really good job, and thank you very much. So Julie, you better sign us off, I guess.
Thank you, John. No, that's fantastic, and I'm sure that's much appreciated. If people have been with us since 9:30, then you get an extra gold star, glass of wine, bar of chocolate, whatever is your thing this evening, because it's been a long haul, but it's been a fabulous day. I really hope that this time next year that we can do this for real, in person. As much as I've enjoyed today, there's nothing like the human touch. So in the meantime, stay safe, everybody. Thank you for sticking with us all day. Thank you to everybody who's worked so hard, and I'll see you all soon. Take care. Bye now.
Thanks, Julie. Thank you. Brilliant.
Bye-bye.
Bye.